done quite a lot of amazing work before. And so on behalf of the government of Kenya, we would like to reaffirm our commitment to accelerating progress against non-communicable diseases through innovative, integrated and equity-centered approaches. Certainly, as has already been pointed by Maria, oral health hasn't received a lot of attention. It's often overlooked, and it's a great lever in the battle against non-communicable diseases. So globally, nearly half of the population suffers some form of oral diseases, and these are intricately tied, very well tied to the non-communicable diseases such as diabetes, cardiovascular disease. She's mentioned oral cancer and several types of cancer. And there's a lot that also at the risk profile in terms of what leads to these problems. They're also tied together with NCDs, issues around tobacco use. You mentioned sugar, so we just sum it as unhealthy diets. The issues around alcohol consumption and a number of other harmful substances that people either chew or consume. There's a lot that we need to do in terms of unifying our strategy, and I believe that's why we are here. And we want to play that integral part as Kenya to reducing the health and economic burden, not just of oral diseases, but also of NCDs overall. And Kenya, we have done some work already, at least at the policy level. We have done some work also in terms of programs that we have started. We have the oral health policy, which goes all the way to 2030, and we have put in some steps that we think we are going to follow to achieve that reduction of the burden on oral diseases, and also reduction of the burden of the contribution of oral diseases to NCDs generally. And what is important for us here is how we are going to collaborate, how we are going to join forces together from the several sectors, and how we are going to achieve equitable access for the populations worldwide. And we congratulate you for achieving 2 billion people that you just reached. And we know that getting on this platform, we can achieve more people that are not just forgotten, more people that are not in this room. And so that aspect of equitable access is very key for us. We have just launched a survey this year, what we are calling the STEP survey. And in that STEP survey, we have integrated oral health conditions as part of what we are asking the population, just to sort of know, alongside the risk factors for non-communicable diseases, we need to get some vital data from the population on oral conditions. We are overhauling our healthcare system. Financing is key for us. Resource mobilization is key for us at the domestic level. We are doing taxes. We are also doing contribution. But what we need the data for more is how we are going to design what we call the benefit package, so that we tackle interventions at the treatment level. But more importantly, also how we are going to prevent at the community level oral diseases. And so we are here to affirm that cross-sector collaboration is essential. We are here to say that oral health transcends beyond traditional health boundaries, and we are here to call on all sectors: education, agriculture, environment, financing, as part of the harmonization of efforts to optimize resources and to address the social and commercial determinants that undermine oral health. And so this partnership is important for us. So distinguished colleagues, we are here to just affirm that we need to adopt innovative policies at the local level, but also at the global level. We are here to inspire and to call on the world to integrate oral health policies as part of the strengthening of healthcare systems. We are here to commit and to champion a comprehensive, integrated, people-centered approach that has not just social impact, but has a health impact for everyone in the world. So thank you so much, and we'll be happy to work with you and to continue working with you in our championing of oral health and reduction of NCDs as part of our approach to healthy population. Thank you.